Good morning and thank you for joining us. My name is Tina Tebow and I'm the Director of Media Relations for the province of Nova Scotia. I will be your moderator for this morning's news conference. Joining us today, the Honourable Chuck Porter, Minister responsible for the Emergency Management Organization, Premier Stephen McNeil, the Premier of Nova Scotia, Dr. Robert Strang, the Chief Medical Officer of Health for Nova Scotia, and the Honourable Mark Fury, Minister of Justice and Attorney General. We'll start with the Premier. Go ahead.
Thank you, Tina. Good morning, everyone. I want to thank all those Nova Scotians who've continued to follow the public health advice and the businesses like grocery stores that have remained open and are taking extraordinary measures to protect the public and their employees while helping slow the spread of this virus. But today, I need to focus on those who are not following public health advice. Over the weekend, I saw and heard of far too many incidents of people gathering, blatantly disregarding the social and physical distance rules of staying 6 feet or 2 meters apart. Hundreds gathering on our beaches and in our parks, large groups of people congregating, young people playing street hockey, cars parked everywhere, people disregarding law enforcement. We are dealing with a deadly virus, and this behavior is unacceptable. And so today, effective immediately, I am declaring a provincial state of emergency. Minister Porter is here to explain what that means, and Minister Fury is here to explain how we will enforce it. We are also reducing the size of gatherings effective immediately. People cannot gather in groups of more than 5. You can still go outside, but you walk to exercise, not to socialize. Stay in your neighborhood. Walk around the block or down the street. Our provincial parks are closed. If you go there, you are trespassing and your vehicles will be towed. You can get groceries, you can go to the pharmacy, but do not do it in packs. Identify a single family member who can do those errands. And if you are an individual helping neighbors, please continue to do so. We are working with our municipal leaders and our First Nation leaders. It is imperative that all of us follow the state of emergency and use common sense. Currently, if you've traveled outside of Canada, you must self-isolate for 14 days. We are now taking this to a new level. Effectively tomorrow, the borders of Nova Scotia will be tightened. As of 6 a.m., if you have traveled anywhere outside of Nova Scotia, you must self-isolate for 14 days when you return. This will be managed at points of entry into our province. The ferries in Digby and North Sydney, our airports in Halifax and Sydney, and our land border with New Brunswick. We are making exceptions for those who provide essential service, including trucking, healthcare, child protection workers, and law enforcement. If you are coming into our province, you'll be stopped at every entry point, questioned, and told to self-isolate. For those who are not essential service and want to enter our province for social purposes, please stay home. This decision was not made lightly, but we must continue to act and use every tool available to flatten the curve and reduce the spread of COVID-19 in our communities and the virus' significant impact on our healthcare system. We have a social responsibility to focus on the public good. A failure to follow public health guidelines to limit the spread of COVID-19 puts our civil liberties at risk. We have no choice but to put more stringent measures in place to contain people to their own homes and to help prevent the spread of COVID-19. Each of us has a moral and legal obligation to ensure that we adhere fully to the orders and advice of our Chief Medical Officer, and there will be no exceptions. I will now turn to Minister Porter to explain what this order means.
Thank you, Premier. This declaration of a province-wide state of emergency underlines the seriousness of the current situation as it relates to COVID-19 and enables the province to enforce its directives. The Emergency Management Act gives us the authority to further protect the health and safety of Nova Scotians and to provide for the broader public good. The state of emergency does not replace the powers of the Chief Medical Officer of Health. Instead, this order extends the province's authority and adds to the important work that has already been done. Under this order, government can control or prohibit assembly as well as travel to and from areas. The order also provides the authority needed to coordinate commerce, activity, and emergency responders so we can ensure people are safe. We need all Nova Scotians to appreciate the seriousness of this virus and the harm that it can cause. Now is the time to follow the direction of our public health officials and support each other and our neighbors. Thank you.
Thank you, Minister Porter. Now I'll ask Minister Fury to explain how we will enforce this order.
Thank you, Premier. Upon the recommendation of Dr. Strang, we are taking immediate action to authorize police to enforce orders under the Health Protection Act related to both self-isolation and social distancing. The Health Protection Act authorizes the Chief Medical Officer to request police assistance to enforce his orders. This means that people and businesses will now face fines for violations or orders made under the Health Protection Act. Many Nova Scotians have taken Dr. Strang's advice and are following the order to self-isolate. However, as the Premier indicated, many are not. We therefore have no choice but to call upon the police and law enforcement community to enforce self-isolation and social distancing. In addition, effective today, social distancing will also now form part of the Chief Medical Officer's order, and police are also now authorized to enforce this order. Starting immediately, police now have the authority to issue summary offense tickets to people who are not adhering to Dr. Strang's order to self-isolate or adhere to social distancing. The fines under the Health Protection Act are for individuals found in breach of the order, $1,000 for each fine for each day. And for businesses and corporations, $7,500 in the first instance and for each subsequent day. People can be fined on multiple days if they fail to comply with the law. Police and law enforcement have been notified of these enforcement measures and are ready to begin implementation today. We've engaged our police leadership. They have requested and we are able to respond to provide them this level of authority. And I want to take this opportunity to thank the men and women in uniform who are on the front line. And as the Premier indicated, their efforts and actions yesterday were dismissed. They now have the authority to fine and arrest if necessary. Thank you, Premier.
Thank you, Minister Fury. And now I'll ask Dr. Strang to update you on the COVID-19 cases here in our province.
Thank you, Premier and Ministers. Today we're announcing 7 new cases of COVID-19, and like earlier cases, they are either travel-related or close contacts of previously announced cases. At this point, none are related to local community spread. This brings the total to 28 cases of COVID-19 in Nova Scotia and 13 between yesterday and today. The individuals affected range from people in their upper teens to into their 70s, and cases have been identified in communities across the province. Public health, every time we have a confirmed case, public health rapidly moves in, understands where that individual has been at the time they could have been infectious, and identifies all contacts and works closely with those contacts to put them in self-isolation for a 14-day period. And if there are community exposures, like you've heard in the last couple of days of the basketball tournament, we make public announcements, but as much as possible, we work with individuals and their families behind the scenes to ensure contacts are in isolation. We've had almost 2,100 total tests done here in Nova Scotia, and I'm pleased to be able to announce that today at the QE2 Health Sciences Centre Microbiology Lab is now able to report both positive and negative tests for COVID-19 as confirmed. This is a good thing. Our tests will no longer have to be sent to the National Microbiology Lab for confirmation, and it will speed up the ability to let people know the status of their test results. As you've heard, and as I've said before, there are no cases right now that are related to community spread. However, as we continue to have cases occurring in Nova Scotia, we can expect that we will soon see this occurring. That is why we're taking the actions that have been announced earlier. We need to minimize and slow down the introduction and spread of COVID-19 in this province. It's critical. It's how we keep people safe and how we're going to actually minimize the impact on our healthcare system. Everyone is at some level of risk. There is severe disease occurring at almost all ages, so everybody is at some risk. But we know that all of us have people in our families or our communities who are at the highest risk of getting severe disease, people who are elderly, people with chronic health conditions. We also all have healthcare workers in our communities who continue to put themselves at risk, working on the front lines to treat people and screen and treat people with this disease. So we all need to work together even though we're all at risk, but it's not just about ourselves. We also need to work together to protect those most vulnerable in our communities, to protect our healthcare workers who are stepping up and willing to put themselves at risk to look after us. I can't stress that enough. So we are still seeing people gathering in large groups. I have said previously, going for a walk or a bike ride is okay. It is still okay, but we need to do that safely, adhering to public health principles, and quite frankly, using some common sense. Now is the time. If you haven't traveled and you're adhering to social distancing, go for a walk around your block or in your neighborhood, as long as you're making sure you're respecting the social distancing. But now's not the time. Do not pile into a car, go for half an hour, park next to 100 other vehicles at a beach, and then crowd onto a beach or into a park. That is not using common sense. That is not adhering to public health measures around social distancing and not having mass gatherings. If you need to go out to a grocery store or pick up things from the pharmacy, have one person do that. Don't all go, and don't take your kids to do that. If people are on self-isolation from travel or if they're a known contact of a case, you need to stay home. You can go, if you're able to, you can go out into your yard or your balcony, but do not go further. You need to get help, to get groceries, to get the pharmaceuticals you need. This is where all the rest of us need to step up to help those people, to help them stay in self-isolation. I recognize that for people in apartments, multi-unit dwellings, this is very challenging. But I'm hearing lots of stories about how their neighbors are reacting to them negatively because they're out in the hallway or trying to take their dog out for a walk or get their mail. So rather than reacting negatively, why don't you step up and say, how can I help you? What do you need so you can stay in your apartment, keep the rest of us safe? How am I going to help you? It's really important, but this is a time where we can come together. We're at the beginning of this in Nova Scotia. Jurisdictions that have been able to minimize the impact and slow down the spread of COVID-19 are the ones that have applied the very strict measures that we have been applying throughout the last week and strengthening today. And the time is right in Nova Scotia. We can make an impact. We actually have the fortunate opportunity, even within Canada, some of our neighbors, Ontario, British Columbia, Alberta, are further ahead than us by several weeks. They have been struggling in the last couple of weeks to apply the same measures we are applying, but with not as much success. partly because they're further down the curve. So we have this window of opportunity to and learn from our Canadian neighbors and internationally and do things better. So it's really important that we actually take this seriously. It's not a time to react with fear, but I would appeal, I use 3 C's. Let's approach this with caring and a sense of community and common sense. Thank you.
Thank you very much, Dr. Strang. And now we'll open it up for questions.
So we'll go to the phone lines for questions. Again, we will take 1 question and 1 follow-up from each reporter. We have 13 reporters on the line. We will try to get to all of your questions. We have approximately 25 minutes. We will go to Shayna Luck from CBC. Go ahead, Shayna.
Good morning. Nova Scotians have had, until now, unrestricted travel throughout Canada, and visitors from other provinces have had unrestricted access to Nova Scotia. Given that other provinces have said they have community transmission, why are you limiting testing to international travel only?
We're not. I'll let Dr. Strang answer that.
Yeah, so we're moving forward. We're not be. So a part of self-isolation. So anybody now, as of 6 o'clock tomorrow morning, anybody who comes into the province needs to self-isolate. If they become symptomatic, they then go through this online screening process, then call 811. They will, if they screen in there, they will then go in for testing. This morning we're already working on changing that screening process within the 811 process. We are also looking at ways that we're starting to increase people who haven't traveled in a limited way to start to detect signs of community spread. We also have been for a number of days looking at building on what we traditionally do for influenza surveillance, tracking the number of people who are going into emergency rooms with flu-like symptoms, looking at if there are any outbreaks of respiratory disease in a long-term care facility or another community setting. So we are continuing to do that, building on what we do for flu season, and if we see any of those signals, which we haven't to date, we would absolutely move in very quickly and start to do testing for COVID-19.
Shayna, do you have a follow-up?
Yes, so who exactly qualifies for testing? Is this now opened up to anyone who is showing symptoms?
So where anybody who's with a travel history, and as of tomorrow, it'll be a travel history outside of Nova Scotia, who develops fever or new cough, they'll screen in through the 811 process, then go to the COVID assessment center for testing. We are working. I have further conversations later today with the lab, with my clinical colleagues, of how we actually do some testing to look at people out into. So we're making sure we're picking up signs of community spread in a timely manner. We need to work out the details of that. We are rapidly working to within the next day or two to double the testing capacity in the lab, but we have to be cognizant of we can't test everybody. We need to test the people who are most likely to be positive while we maintain the ability to be able to test people with significant illness.
Thank you, Shayna. Next, we'll go to Nick Moore from CTV. Go ahead, Nick.
All right, good morning. If somebody does see people violating this state of emergency order, people gathering in large crowds or people who should be self-isolating that they're not self-isolating, is there a way for them to report that to the proper authorities?
Ask Minister Fury to respond.
Yes, where those circumstances are observed, we are now encouraging people to contact their local police agency of jurisdiction. And at that time, with the information and authority the law enforcement community has now, they will take appropriate action.
Can I make a comment on that too? So I think it's also important, going back to my previous comments, that we all have to work together. And not just rely on authorities to enforce this. So if somebody's out there that you think maybe should be in self-isolation, first of all, is engage them if you can and feel comfortable doing that and safe in a conversation. Maybe there's a reason, maybe they actually, your judgment on them may be incorrect. Maybe they need to be social distancing rather than self-isolation. But maybe there's something they're struggling with that they need help with that's forcing them to come out of self-isolation. So rather than be negative about each other, I'm encouraging people as the first step is let's figure out how we support each other to help those who need to be in self-isolation stay in self-isolation before we go to an official complaint.
Nick, did you have a follow-up question?
I do have one. Thank you for that. My follow-up is, can I get clarification on whether or not this order issued today, if this does effectively close shopping malls throughout the province?
Effectively, not at this particular moment. They will have to adhere to the 5-person rule. Dr. Strang and I will be having further conversations today about the next phase, but they will, and as shops, will have to also look at the 5-person rule. But there will be no public gathering in a shopping mall as of today. You'll still have access to it.
Thanks, Nick. Next, we'll go to Elizabeth McSheffrey from Global News. Go ahead, Elizabeth.
Hi there. I'm wondering first what the state of emergency will mean in terms of protocol changes at the airport. Will there be any beefing up of testing or criteria in the airport here?
Minister Porter.
Thank you. The airports are currently being monitored by provincial staff at the current time through our enforcement officers out of environment. That will continue. We will upgrade information, and we will go through the same process we will do at all other points of entry, which will be asking the appropriate questions on whether they've traveled, where they've traveled from, and other questions.
Elizabeth, do you have a follow-up?
Yeah, just to follow up on Shayna's question. For those people that currently don't meet the criteria for testing but are showing symptoms, of course they're to self-isolate, but what can they be doing at home to treat themselves and care for themselves while they presume they have COVID-19? What should they be doing at home?
So we're asking people with any symptoms, as always, they should try to isolate themselves as best they can within their home. If you've got fever or cough, whether it's influenza, whether it's COVID-19, staying away from the public spaces and even within your home as much as possible, distancing yourself from anybody else within the home. So staying that six feet or 2 meter space apart as best you can. Staying, if you're able to, in your own room with your own bathroom, having somebody bring meals to the doorway. I know that's not always possible for all living circumstances and all families, but as best you can, adhering to those public principles of social distancing, that 6 foot space, and really careful, frequent hand washing by everybody in that household, cleaning down common surfaces.
I think it's also important, if I can, whether you've traveled or not and you're at home and you've been self-isolated because you know someone who's traveled and you are showing those symptoms, call 811. They will direct you. We have a couple of cases where people haven't necessarily traveled, but someone very close to them has, and they've received the virus from them. So I don't want to. A couple of questions here has only been that only the people who've traveled are being tested. That's not accurate. What's happening is if you follow the online tool, and it identifies these symptoms, you call 811, and you will be directed to the appropriate place to ensure that that's happening. Of course, travel history is an important part of that, but as Dr. Strang has said a number of times when I've been sitting here with him, we have some that are connected to people who have traveled. They themselves have not. So follow the symptoms, follow the online tools, call 811, and we will be there to work with you.
Thanks, Elizabeth. Next, we'll go to Tim Arsenault from the Chronicle Herald. Go ahead, Tim.
Thank you. Some people are wondering why the NSLC outlets are still open. I'm wondering, given what's being said this morning, can you speak to that?
Well, they've been kept open at various degrees across the province. Hours have changed. Access to them has changed. We've now closed them on Sundays. We will continue to monitor that as we go forward. I think there's also an important part there. There are, quite frankly, those Nova Scotians whose health requirements needs access to this product. And we also know there are family situations where people are living in very difficult circumstances, whether it's domestic violence or abuse, that the restriction of this product could escalate that. But we are monitoring what that looks like as we continue in time, and we'll continue to follow the advice of public health.
Do you have a follow-up, Tim?
Related. If mobility had to be restricted even further, are there measures or plans for how people will go about getting things like groceries, prescriptions, those sort of essential items?
Well, in my remarks, I've said you can continue to do that. Just don't do it as a group. Don't do it as an entire family. Identify an individual to go do that. Many of our retailers have put online opportunities where you can do online shopping, and they'll bring it out and put it in your car. But you can go, of course, and do those things and then come home. And I would also encourage you, as Dr. Strang has mentioned here a few minutes ago, how can we support those who may have more challenges? If you're a single mom with kids at home and you're their neighbor, ask, can you help? If you're a senior living alone, and your neighbor's a senior living alone, ask, how can you help? If you're going to pick something up for your family, think about identifying whether you can pick something up for them. That's how we can actually restrict the mobility and, quite frankly, slow down this virus from impacting all of our families.
Thanks, Tim, for that question. Next, we'll go to Devin Stevens from All Nova Scotia. Go ahead, Devin.
Hi, can you talk a little more about what triggered today's announcement? I know the Premier mentioned, overflowing parking lots at beaches, and there was some social media posts about that today. Is the government monitoring social media for this type of thing? Are you getting calls from the public? Are provincial, game wardens and park officers noting this stuff? Just a little bit more about what specifically triggered today's announcement?
Well, the vast majority of Nova Scotians are following the public health advice. And they become frustrated, quite frankly, when a small percentage of Nova Scotians don't. So they certainly identify, they call into, whether it's in our Department of Forestry, who manages the parks across the province, they would call into the Department of Health. And yesterday, when those calls came in, we dispatched law enforcement to deal with the issue. And quite frankly, they weren't taken seriously. They weren't, people were disregarding the men and women in uniform. And we cannot allow a small percentage who choose to do as they wish in our province to put at risk the health of the rest of us. And that literally is what this is. If you've watched this virus globally, and quite frankly in Canada, in some of our other Canadian provinces, the spread of this happens rapidly and quickly. And it will require all of us to do our part, to self-isolate, to protect our neighbors, and to respect law enforcement, health professionals who are working day and night to provide us the security that we require and, quite frankly, the health care that we need. And I want people to fully understand this. The spread of this virus in itself is bad enough, but the stress that it will put on our healthcare system will be crippling. It will not only impact about how we deal with this virus, it will deal with how do we deal with cardiac arrests. It will deal with how do we deal with all of the other emergencies that flow into our hospitals on a daily basis. I cannot allow a certain level of Nova Scotians to disregard the order of the Chief Medical Officer or law enforcement when it comes to ensuring we protect the health and safety of all Nova Scotians, and that's why we were forced to do what we're doing today.
Devin, do you have a follow-up?
Yeah, for Dr. Strang, we're probably going to have people coming off of self-isolation in the next 5 to 10 days here. What is your guidance to them on day 15? Can they go grocery shopping? Can a grandmother coming home from Florida go visit her grandchild if there's been no illness in either household? How will life change for those people on day 15?
So once they come off self-isolation, they move into the bigger bucket of all other Nova Scotians who were asking and telling they need to maintain the social distance. So that's the group that still has to be careful about shopping for essentials, not in groups. One person from the family. They can have some outdoor activity in their yard, in their community, but not doing it in groups. And doing it in a way that respects the 6-foot social distancing. so they become like the vast majority of us. But we're going to be in this for weeks, and we all have to, all of us have to be practicing the social distancing, and there will be people that move up into other categories of stricter self-isolation, and even maybe even as a case on a very strict at-home self-isolation. They don't have to be in the hospital, and then move back down. But all of us have to keep practicing that it's strict social distancing. And as I'll emphasize, it's really about physical distancing. At the same time, we need to find ways to increase our social connectedness using our devices. But as the Premier said, as I said earlier today, how do we find ways to reach out and support each other in our communities while we still respecting that physical distancing? But it's critically important that we are connecting with each other in non-physical ways that supports each other through this very difficult time.
Thank you, Devin. Next, we'll go to Matthew Moore from News 95.7. Go ahead, Matthew.
Yeah, thanks, Tina. I think my question is just the confusion about malls. Can you discuss the fines that if someone went to a mall tomorrow and there's 10 people there, what's that going to do? Because it seems like that's a little ambiguous right now, I suppose.
No, what you would find is that law enforcement has the ability to go into a mall, and if you were hanging around in the general space of the public space of a mall, you'll be asked to disperse. If you choose not to, you'll be fined. If you're going into the mall to go directly to a particular store, then that's what you do. You go in, you enter the mall, and you go directly to that store. You purchase what you're looking for, and you exit the mall. The common area will be treated like common space out in community.
Do you have a follow-up?
Yeah, just one quick one. What does this do for, like, dealerships and call centers, too? Because those are kind of confined spaces, too, I suppose.
We have a number of employers who have worked very hard to ensure that they've created the appropriate self-distancing protocols inside of their businesses. Some have double shifts, so they take fewer people in. They've separated, whether it's a call center, the connection, how close people are to one another. Many of those workplaces that are still functioning have followed the advice of the chief medical officer and ensured they put the protocols in place.
We have about 10 minutes left. We only have time for a few more questions. We'll go to Jake Boudreau from the Port Hawkesbury Reporter. Go ahead, Jake.
Because those are quite confined. Thank you, Tina. I was just inquiring about the confusion there seems to be over self-isolating versus quarantining. It seems like you guys are kind of going close to calling on people to quarantine, but there seems to be some public confusion as to the difference between quarantining and social isolation, with, quarantining being the more, I guess, extreme or whatever you want to call it term. Is there any way you guys can kind of clarify that? Because I'm seeing a lot of comments on social media and things like that.
Yeah, so quarantine is actually a technical term. The quarantine is somebody who has potentially been exposed but is not yet sick. And then isolation is somebody who is sick. Because of the language piece across the country, we're using self-isolation as the term, both for people who may have been exposed and need to stay at home away from others, as well as for people who, even if they're sick, they're self-isolation. So it's social distancing for everybody, or the physical distancing with increased social connectedness. Then people, because of travel, or if we know that they've been exposed, that's self-isolation, which in a technical term is quarantine. And then for people who are sick, it's a very strict house isolation, which the technical term for that is isolation.
Do you have a follow-up, Jake?
No, I don't.
Thank you. Next, we'll go to David Jalla from the Cape Breton Post. Go ahead, David. All right, we'll move along. We'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, thank you. And I'm sorry to beat this drum, but there's widespread public concern and questions over testing. And Dr. Strain, you said that it's obvious that you can't test everyone, and I suppose that's true. But can you say what the limiting factor is? Is it lack of availability of tests? Is it lack of staff? Is it time? Is it too much money? What is it that is keeping you from spreading testing further than it is already?
So as I said, we're rapidly working and to double the capacity for testing, and that's doing things at the lab, bringing in extra staffing for other components of the lab, changing their processes. We're also looking at using different types of swabs to make sure we actually have adequate swabs that are available. We're looking at possibilities of even increasing the sophisticated equipment that's there. That's not easy because there's a global demand for that. But so we're doing everything we can to increase our lab capacity. But also we've got to be careful that our testing strategy maintains the likelihood of identifying people who have the highest possibility of having this disease and not overwhelming our system by testing absolutely everybody. So we're continue to work on both those strategies, enhancing our testing, maximizing and testing the appropriate people as we working diligently to maximize our lab capacity.
Do you have a follow-up, Tim?
I do. Related to that, recognizing that you can't test everyone, why aren't people at airports and crossing the borders, why aren't they being checked for their temperature?
So the evidence is from other pandemics, epidemics, is actually temperature testing is not actually very helpful. We used that during H1N1 and other parts of the world, and it clearly showed that doesn't really make a difference because that's a one point in time. The reality is that most people are going to be feel well as they're traveling. They're going to get home, and then it's going to be in those next few days. So if I do a temperature check on somebody just as they cross the border, it really tells me nothing about what their likelihood is of becoming sick in the next few days. The information that people are given now as the airport and as starting tomorrow as our ferries and our land borders includes information about if you have or develop these symptoms, online screening and then calling 811 is appropriate. And that is the best strategy to help people understand the type of symptoms they need to watch for and how they manage and reach out to get appropriately tested when they develop those symptoms, rather than just screening temperature checks at border entries, which are not effective.
Thank you. I'd like to just add to that, too, to be clear around travel and our borders that was described a few moments ago. If you are coming into Nova Scotia, you must self-isolate for 14 days, no matter where you're coming from. If you are coming in to any one of those borders, you must self-isolate for 14 days. I just wanted to be clear on that. Thank you.
We'll go to David Jalla once more time from the Cape Breton Post. David, are you there? And that's all the time we have from the phone line, but I will ask Minister Fury, we did get a question from the phone. He had to drop off. It is from CBC News Network in Toronto, and the question, Minister, is around Nova Scotia Police. What sort of summary offence tickets can be issued?
So there are two offenses. One by an individual failing to obey the order of the Chief Medical Officer for Health. And the second is for businesses who fail to comply with the order of the Chief Medical Officer of Health. The individual fine is in the amount of $1,000, and the fine for businesses is in the amount of $7,500 with increased costs on a daily basis.
That's all the time we have for media questions.
Thank you, Tina. I want to thank all Nova Scotians who've been following the public health protocol. But I cannot allow a small group to put their own self-interest ahead of the collective health of all Nova Scotians. As the Premier of this province and as the Chief Medical Officer of Health, it is our jobs to create the conditions to keep you safe. It is your job to follow them, to keep yourself safe and all Nova Scotians safe. If you cannot follow the laws that we have put in place today, there will be consequences. This may seem harsh, but it is necessary. I care about this province, and I care about all of you. Be kind, be compassionate, and most of all, please use common sense.